Hi, I'm Chelsea Vale from Barsky Vale Designs, co-creator of the Woombie Med Pod line. I want to talk with you today about the way that Woombie Med Pods work when it comes to wires and leads. So these were really designed to work around medical devices and treatment needs. We've really taken a lot of care in deciding where each of the slits and lines and zippers and everything go because these were created by a registered nurse and BSN as well as a child life specialist, myself. Both of us are very familiar with the hospital system and the way that lines and leads and cords and monitors and so forth go. So one of the things that we've done to make sure that the Woombie Med Pod goes for all babies in the hospital is we've added a double zipper. So if you were to unzip the very top of this, or if you were to unzip the bottom of the Woombie Med Pod, all of the leads and lines and cords could either hang from the bottom if they're in the bottom half of the infant, or they could hang out of the top on the top half of the infant. If you'll notice, there's also two slits right here in the sides. These could be for EKG leads. They could work for chest tubes, drains for maybe a post-surgical patient, or there's also two slits up here at the top. Perhaps if you have a HEMOC patient, that this were on the baby, you would pull this to the side to access the port or access the Broviac, or the Broviac leads could hang out right here. This is stretchy and it's double stitched, so it's not going to tear. It's going to hold its shape. The Broviac leads could be right here. So if you'll imagine the Broviac leads hanging on the outside, a nurse could come with her feeds or her blood or her tubing, whatever she's accessing the patient with, simply hook it up here and not disturb the baby. The reason we focus on not disturbing the infant is if you'll notice when you unswaddle a baby, a lot of times they have a stress response. They're going to arch their back, they're going to splay their fingers and splay their toes, they're crying, they're very upset. What that does is it ignites the fight or flight response in the brain. It ignites those stress hormones. And what we're trying to do is to decrease the wrapping and unwrapping that happens in the hospital. If you consider how often an infant is accessed for their treatment, or for vital signs, a lot of times they're Q2 or Q4, which means every 2 to 4 hours they're getting their vital signs checked. That's a lot of unwrapping and rewrapping, and it's not just a nuisance for caregivers and staff, but it's also very uncomfortable for the baby and very disturbing, and it's a lot of negative touch and hyperstimulation. Also, we have convertible arms out or arms in option on our Med Pod. So for an older baby, you can keep them cocooned, keep them swaddled, keep them warm. Simply allow the arms to be out for a bottle feed, to self-soothe, perhaps to play with a mobile, or play, just maybe touch a caregiver and then put the arms back in for sleep. Simply snap it up. It's not going to require a lot of wrapping, unwrapping, weaving of lines and cords and so on. The Billy is no different, except for it doesn't have any of the slits and lines, but Billy babies do not have as many cords. The ones that they do, for example, maybe EKG leads, the stickers are going to be held close to the chest and the lines can hang out of the top or out of the bottom, but the Swaddle is still providing the boundaries and containment that infant needs. Our gastropod and our trach pod also do have the slits that are specifically placed for the tubing and the wiring. Now, some nurses say, well, I don't want to have to unhook my baby and rehook the baby back up to get in the pod. You shouldn't have to. You should just be able to simply unzip the pod. I'll use the Med Pod here for an example. Unzip the pod. Place the baby in the swaddle. Arms down is the best way to start. It's easiest if you'll go ahead and pull this together. Hold it up there at the top where the protector is. Zip it up. We did get an email from a nurse that said, well, it's not developmentally appropriate for a baby to be swaddled with their arms by their side. That's the beauty of the Med Pods. We also agree. It's not best for babies' arms to be at their side. Babies need to have hands over heart, hands at midline, maybe hands up here, kind of a fetal position. This is what a lot of babies do. They might kind of self-soothe with their fingers up by their mouth. The beauty of the Med Pod is they can move within the swaddle without making it come loose. It's not going to lose its shape. It's not going to go up over the mouth similar to a blanket. It will hold its shape, keep infant contained, warm, and feeling safe. The Woombie Med Pod, Billy Pod, Gastropod, and Trach Pod can all be purchased at woombiemedpods.com, or you can call us at 1-833-MED-PODS, and we can help you secure an order by issuing you a PO digitally, or putting together an invoice for you. woombiemedpods.com or 1-833-MED-PODS.